Hello and good afternoon, everyone. Thank you for joining us on our webinar about our graduate entry medicine program today. My name is Cecilia Wu. I'm the recruitment manager at Swansea University Medical School. And today, two of our presenters will be Dr. Heidi Phillips, admissions director for the graduate entry medicine program, and also Daniel Thomas on our graduate entry medicine program as a current international student. So first of all, I'm going to give you a brief overview of where we are, where Swansea University is located. So Swansea is in Wales. We're based in southwest of Wales. We're the second largest city within Wales with a population of approximately 250,000 people. Travelling from central London to Swansea, it will take about 3 hours by train. Wales has its own capital, which is Cardiff, and if you were to fly into Cardiff International Airport, from there by train to Swansea, that will take approximately an hour. And this is an aerial picture of the Swansea University Singleton Park campus, which is where the top part of the medical study will be based. And here's a little video of our recent statistics, which we're really proud of as a medical school. Okay, and now I am going to pass the speaking to Dr. Heidi Phillips and Daniel Thomas, and they will tell you more about the course itself.
So, hello, my name is Heidi. I'm a GP, a general practitioner in South Wales, and I'm also one of the admissions directors for graduate entry medicine.
And my name is Daniel Thomas. I'm a current international graduate entry medicine student here at Swansea.
And hopefully today we're going to give you a little bit of an insight into the course, how we select to the course, and hopefully not need to give you very much convincing as to what Swansea has to offer and why you should choose Swansea. So we've got a little bit of difficulty technically with our slideshow. So whilst we organise for that to be sorted out, the first thing really to tell you about Swansea University is that it is a campus university, and on the campus it's right next door to the hospital. So your studies and your clinical placements are alongside each other for a large part of the course. What we need to tell you about the medical school is basically what you've seen on the little short video clip. We're first in the UK for research environment, and we are a top 5 medical school. We're very proud of that. But one of the things that it doesn't say on this slide is that our students from Swansea voted themselves the most prepared in the whole of the UK for medical practice. So when they surveyed junior doctors in their first job out of medical school, Swansea came first. So we are really proud of that. So we needed to come up with a curriculum philosophy, really. What is it about Swansea? And we developed the Swansea 6S model, the Swansea success model. The main point, the main S that we really feel proud of, our unique selling point for Swansea, is the fact that we are small. And by small, we do mean supportive, which can be a two-way process, really. It's good and it's bad. If you think of small being supportive, we can absolutely make sure that you are the best you can be. And it is in both our interests to get you through and qualified as a doctor. The downside is there are only around about 75 of you, and therefore you can't escape. You can't sort of roll up and enroll on the first day and then disappear for the next 4 years. You will know all the faculty, you will get to know everybody really well, and everybody will get to know you. You'll know everybody in your own cohort and everybody in cohorts ahead of you in the medical school.
An important philosophy for me, I think, is because it's spiral. So we keep revisiting topic every time, and a clinician can teach you, but however, as we know, you might not understand from a particular clinician. But when someone else teaches you and talks about it from a different dimension, it's always find out that you understand a lot better in that kind of instance. And revisiting topics daily, day in, day out, enables you to understand. And coming to lectures is actually quite effective, rather than some other degrees and courses whereby you come to lectures and you find out you don't actually learn anything, but you actually learn different situations and the same thing over and over and in a different dimension here at Swansea.
Yes, it's basically looking at things from different angles.
Yeah.
So that if you don't understand it from one perspective, producing it and reinforcing it in another perspective by a different clinician can sometimes be the difference between understanding it. The other thing really about Swansea is that we start you off with patients from week one. It really is situated in the clinical setting. We feel passionately that the Swansea course is about patient-centred medicine, putting the needs of the patient and the public absolutely at the forefront of what we do. So teaching you in a clinical environment with the patient as you're learning. I think the other thing to really say about this is the fact that we are student-driven. We ask for feedback on pretty much everything.
Yeah, feedback is made after every week. Feedback is always required of you on how to improve the course and how well you thought something could have been taught, or how well it could have been presented by a clinician, which is always good because students need to be able to understand, and that's the point of a medical school, rather than just delivering lectures. Things are continually changed for the betterment of the students, and also this enables you to learn even more because you know that your viewpoints and your accounts are going to be taken into considerations as well.
Absolutely. So if you don't understand something and you can feed it back, we can make it deliver it in a different way to help and make sure that you do understand it. Okay, so a little bit of the sort of technicalities of what the programme looks like. It's a 4-year fast-track graduate entry programme, and 4 years, it doesn't mean we can make the course any less intensive. It means you're doing everything you would otherwise do in a 5-year course, but in 4 years. So it is a really intensive course. It's split into 2 phases, pretty much, years 1 and 2, and then years 3 and 4. And that's basically the difference. Year 1 and 2 tends to focus more on the sort of science background to diseases and illnesses, and phase 2, years 3 and 4, are more clinically focused. But as I said at the beginning, you are seeing patients, and the course is based on patient presentations right from day one. Because we're a university-based medical school, we do have to fit into the university assessment structure. So it's a modular-based course, and you're assessed on 3 different modules. Your knowledge, that's module scholar and scientist. how you perform as a practitioner, so the practical aspects, and your professionalism, how you actually interact and hold yourself as a doctor, how you communicate with patients. The medical school actually is based on Swansea Bay. It's a minute from the sea, but you could be placed all over southwest Wales, and basically the hospitals around the area are all very, very used to having students and very accommodating, and actually getting out of Swansea and seeing district general hospitals and how they function can be really useful. So the phase one, the basic first 2 years, are based on learning weeks.
Yeah, so in our first week, we had diarrhea. So a patient presented with diarrhea, and it's based on how you solve this case. So the clinician goes into the anatomy of this. We go into the physiology of the guts. That's the gastrointestinal system. We also go into how you should start thinking of diagnosing cases and treatment and management, which is all based on a particular case of a patient presenting with diarrhea. And in that week as well, we also have integrated clinical method, which is just about learning clinical skills, clinical science, and examinations as well, intimate examinations on how to diagnose what could be wrong, how you can differentiate between a patient that is ill and a patient that isn't ill, learning to recognize sick and unwell patients that are acutely sick or ones that are chronically and could survive for the next 5 days if so. And this is also triage, so which is really important, and we do all this in the integrated clinical method. And we also, from the third week, go on community-based learning. That we go to the general practice from the third week of our course, and we do this about 10 times a year, and you quickly learn how to deal with patients, how to manage expectations. You learn about how to communicate with patients effectively, and even communicating with other clinicians effectively. And all this are done right at the start of the course, which is really important as a doctor to be able to hone into on that skills.
Yes, it's very much different to other courses where you can spend the first 2 years based in a lecture theatre, and it's 2 or 3 years before you see a patient. This is very much patient-centred from day one, and it's important to know the difference between case-based learning and problem-based learning. So this is not a PBL course where you're left to find it out for yourselves. Case-based, I prefer the term patient-centred, but basically it's about how the patient presents, what illness, what problem they present with, and unravelling that through each learning week. As well as this, we also offer within the first 2 years something called learning opportunities in the clinical setting, or LOCs, and these are a really popular part of our course. They are mandatory. You do have to complete a minimum number of LOCs, but they are your opportunity to investigate further something that you're interested in. So we have a bank of over 750 opportunities, and that ranges from things like going into a prison and doing prison medicine, going out with a paramedic in the back of an ambulance, going to theatre, pretty much anything you can think of. And as I said previously about the feedback, if there's something you'd like to do, then tell us and we could put it into the LOC system.
Yeah, you could get into LOCs from the first week you get here. You just have to do about 10, a minimum of 10 a year, and it's compulsory to do a LOC in medicine, surgery, and also you're advised to do psychiatry, but it's not required for progression. However, as Hadi has just said, LOCs are mainly used for developing your skills, communication skills, working with other clinicians, working with nurses as well, working with paramedics. An important LOC I remember is when I was working with a paramedic, and I was in the ambulance car. We went to different cases. I was easily able to see pre-hospital medicine and the steps required to take before patients come into the medical setting, into hospitals, which is quite important. So you understand from a patient's perspective what they've gone through, how their living situations are around the environment. And I think this loss gives us an opportunity to see all that. You can see, as Heidi said, you can go to a prison and see how it is. So rather than just being confined in a hospital or being confined in a general practice, you get to experience a wider range of activities in clinical settings.
The other part of the first phase of the course are the apprenticeships. These are where a pair of students will be attached to a consultant and will follow that consultant round and understand really what a doctor does, where a doctor does it. So they're not specialty based, they're not specific so that you will learn about, for example, women's health, but you will learn about how a doctor does the job they do. And it's about role modelling, it's about being an apprentice. If you have any questions as we're going along, by all means type them in and we will come back and answer them at the end. Coming on to phase 2 of the course, that's the sort of more clinical based years. We still have learning weeks where we bring you back and we tell you the sort of didactic teaching that we need, but we also have more clinical apprenticeships, so more opportunities in different areas to understand and delve deeper into what's going on in the doctor-patient relationship. We also have continued community-based learning, so you will continue to go out with a GP throughout all 4 years. We also have specialty attachments in the later years with an elective at the end of year 4 and a senior assistantship. So I will go on to talk about what each of those means. This is a typical curriculum map. Things get tweaked along the way year on year on the basis of feedback, but this was the map that we had for last year. The most important thing I think to point out to you is that the white space is holiday. There's not an awful lot of white space on the map. The red spaces are assessments, so it is a continually assessed course. That has its pros and its cons. Basically, you're continuing to learn, you're continuing to be supported, and you're continuing to measure yourself to see how well you're doing. The downside is it can sometimes feel like it's a permanent assessment. The yellow throughout the course is the clinical experience. So you can see that there is a huge amount of yellow within our course. The blue is the sort of formal based learning and teaching.
It's also important to highlight, if you look at year 1, which is the first row, the pink part of it is a formative exam week. And this brings you into medical school. It doesn't count towards progression, but allows you to understand what you actually need to do to be at the level in medical school of where you are meant to be, which is quite good, I think, because a lot of medical schools don't have that. But however, Swansea wants you to progress, they want you to pass, and I think it's been an innovative way of ensuring everyone knows they have to be at the top of their game, because it's quite a difficult course. Everything is in 4 years rather than 5 years as it is in other medical schools.
So, as Daniel mentioned earlier, the learning weeks would be assigned to a theme. So we might have gastroenterology and we might have a patient presenting with diarrhea. And then the elements that make up a typical learning week are looking at the gut in that particular case, with the structure and what it looks like, the physiology, how it works, the pathology, what happens when it all goes wrong, how you as the doctor would diagnose, investigate and treat what happens when it goes wrong, and also medicine, health and society. So that patient, but in their wider context, the context of their home, the context of their environment, the context of the public. And throughout all the weeks, the fun part, ICM, the integrated clinical method, where you get your hands on, you get to practice, and you get to get expert at it.
Definitely, this is ICM is definitely what a lot of us look forward to during the week on Thursdays. We get to practice, as you said, to get to learn the clinical skills, cardiovascular examinations, respiratory examinations, neurological examinations, which I'm quite fond of actually. And you learn about all this, you learn about the clinical signs, you learn about different names, you learn about how to differentiate between patients that have these signs and that don't have it, or the ones that are caused by the different pathologies that are there. Which is quite interesting because this is what we actually came to medical school to learn, and we learn all this right from the first week. You learn about history taking, which is a really important part of medicine, allowing you to formulate differential diagnosis right from an early stage. And this is a very important part in that make up junior doctors' lives, because when they write cases, they always have to put differential diagnosis. And when you've got 4 years to start practicing that, it makes you more perfect at it before going into the job.
Yeah, no wonder our graduates are prepared.
Definitely. True.
Okay, so I mentioned that it's student-centered, student-directed, and that's true. Although it's not a PBL curriculum, we don't sort of land you in at the deep end and expect you to swim. We certainly don't spoon feed you the curriculum. So basically, we will give you the elements of what you need to learn. We will expect you to fill in the gaps. So we will direct you to the resources. We will provide the scaffolding surrounding the lectures, but the learning and what you take away from it will be up to you. And it is important that you know that your learning both in and outside the classroom are what will be assessed. So the majority of the clinical placements are in and around South West Wales. The idea being that although a lot of students believe they want to stay in and close to Swansea, the reality is the teaching and the experience that you get in the district general hospitals is also fantastic, and you get to see a wider range of patients, a wider range of medical presentations, and also practicing in a more rural area. With the clinical apprenticeships, which go out through the curriculum, this is where pairs of students will attach to a consultant and learn about role modelling and how to be a doctor. Its primary purpose is not to learn about the specialty itself, but to learn about how a doctor does what a doctor does.
And if you come back to the clinical apprenticeship as well, although you're not meant to learn about this specialty, but as the doctor once told me, it's diffuse learning. You also learn about the specialty, you learn about the drugs that consultants and the clinicians use, you learn about the patient group there, which is, I think, is one of the best things that we could have in our first year as well. We have a 5-week clinical apprenticeship in our first year, and this exposes us to hospital medicine right from the bat. And we are also able to communicate with different range of clinicians, nurses, because we have a 1-week nursing week on the 5-week placement. We're able to communicate with the healthcare assistants, doctors, ranging from the junior doctors to the most senior doctors, which are consultants, and we're able to understand the different paperwork that are required. We see different things written down. Questions, clinicians are always open to questions, which we always do, and we learn from that, which I think is great.
Yeah, absolutely. There's no such thing as a stupid question. I think if you're thinking it, then someone else probably is as well. The specialty attachments are where you actually go in larger groups, usually of 10 or 12. And these are where you actually get immersed into each of the specialties. So women's health, child health, mental health, things like ENT, dermatology, where you actually learn more about that concept and that topic than just being a doctor and taking histories. But as Daniel said, it's diffuse learning. You'll be amazed at what you pick up almost just through osmosis as you go through. The specialty attachments are more structured, so you're actually given specific clinical activities that you need to complete by the end of your placements. And you'll have timetabled activities, so teaching about x-rays, teaching about clinical skills, teaching subject-specific examinations, history taking, etc. We've got a new offering that we're hoping to bring into place next year, which is an alternative to that third year of hospital-based specialties. And this is where we are going to be bringing in community care placements. So this is an option for those of you in year 3 to, rather than see and learn medicine through a secondary care lens, that you actually see it from a primary care perspective. So as a patient presents to primary care, you will see a patient at that point. You will take a history, examine, investigate, and then you'll learn your secondary care by following that patient, or basically going into secondary care to see what clinics that patient would experience. So rather than a 5-week placement on a cardiology ward, you would be going to cardiology outpatients, going to a ward, maybe going to cardiology theatre to understand it from a primary care, from the patient's journey and from the patient's perspective. The difference, I suppose, is that this is small group teaching, and you will have a one-to-one educational supervisor to sort of guide you through that process.
And when I heard about this, I thought it was a very great idea, because in my last clinical apprenticeship, I witnessed a surgery. I was in a surgery on the child with clubfoot in trauma and orthopedics. And going far forward, I saw a 14-year-old boy with the same condition, and he looked completely normal. It just shows you the impact on following a patient up, which clinicians do, because he had the exact same surgery back when he was a year old. So it's important, even though it's not for that long, but it's important to be able to know how a patient's progression is, so you understand the treatment modalities of everything.
Absolutely. And the important thing to remember with this particular pathway, you will still come out with an MB BCH in medicine. It is not that you will be a GP at the end, but it may be something you'd be interested in if you'd like to have more of a primary care focus in your learning. At the end of year 4, we also have the opportunity for you to undergo an elective if you want to. We have approved placement provider status with a number of partners, and in addition, 20 students can take apprenticeships in Gambia under our Wales for Africa scheme. So we actually have an exchange program where one of your apprenticeships can actually be spent out in Gambia with a clinical tutor. If you're interested, have a look at hashtag TOWIEMedics18, which shows photos from the current 4th year students' electives, and that'll give you a taster of what's to come. Finally, in the final year, we have senior assistantships, which again are something that Swansea are very proud of. When I was a junior doctor, when I just qualified, I remember starting my first job, and we were all told to bring along an overnight bag just in case we were going to be on call. We had a full day of induction, and at the end of induction I was handed a bleep and told I was the on-call doctor, and it was terrifying. We don't do that anymore. Basically, if you decide to stay in Wales for your F1 junior doctor post, we will give you a 5-week shadowing period following the doctor whose job you'll actually be doing, so you can really understand the ins and outs of what you need to be doing when you take over that job. So it's no wonder that Swansea students feel the most prepared.
Yeah, during a placement in my locks, where I studied a junior doctor and an elderly ward, She seemed very prepared for it. A Swansea graduate as well, very prepared. She understood the different things she was meant to be doing, both the paperwork and the treatment of the individual patients. And I asked her how she was able to progress into it so quickly, and she said because she had shadowed the doctor that was there previously, and that is quite good because you can you're not put surprises are not sprung up upon you. So I think that's a great idea.
You feel prepared?
Yeah.
Okay, I'm not allowed to pass this slide by. The Institute of Life Science, we had one, we now have 3 on campus, and we are a centre of research excellence. We have innovative medical product development and design and great links with industry. I mentioned LOCs, learning opportunities in the clinical setting. For some of you who have a research interest, there can also be the opportunity of laws, so learning opportunities in a research setting. These aren't compulsory, but they may be something you'd like to look into. Okay, so now to the nitty-gritty of how we actually select you. We have over 1,000 applicants for 70 places, so it is highly competitive. So we need to be able to reduce that number down to a manageable number of people that we can interview, and we do that using the GAMSAT score. So basically, we take the top performers in the GAMSAT and we offer them the opportunity of an interview. You have to have satisfied the eligibility criteria, which is shown on our website, and include a minimum of a 2-1 or a 2-2 plus a higher degree. That 2-1 can be in any degree discipline. It doesn't have to be science or biomedical science. We have had artists, philosophers, sculptors on the course, and they've all done as well, if not better, than the biomedical sciences. So what are we looking for when you come to interview? When you come to interview, we don't worry about how you've gone before. We don't revisit your academic knowledge. Interview is purely the place where we look at what kind of person you are. I have no doubt that many applicants would make fantastic doctors. The problem we have is we only have 75 places. So we need to find those who we think have the best fit for Swansea. So what are we looking for? Obviously, communication skills. You need to have the knowledge, but you need to be able to communicate that knowledge in a way that can be understood. You also need integrity, honesty, and insight, the ability to be able to reflect on yourself and your behaviour. If something's gone wrong, if something hasn't worked out the way you wanted it to, you need to be able to put your hand up and say, it was me, this happened, this is how I'm going to do it differently next time. You need passion. You need to know why you want to be a doctor. And also, why Swansea? Why Wales? Resilience, that's bounce back ability. What you do when the going gets tough, how do you keep going? Because medicine is hard. Coping with pressure is one of the aspects of things that we look for. It's tough. Juggling all those balls and trying to keep them all in the air can sometimes seem impossible. And sometimes medicine is actually about understanding which ball you can put down and when. And problem solving. Thinking outside the box. Thinking differently. How could you approach a problem? Not in perhaps a traditional way, but an innovative way. We also do look at your referee's comments on your personal statement. So your interviewers will have a copy of your personal statement and will have your references. So in the selection centre, we bring you up for the day, and what do? Well, the assessments are basically 3. 1 written exercise and 2 interviews. The written exercise is not something you can study for. There's no right or wrong answer. It's basically a situational judgment test. that will give you some scenarios, ask you to prioritize those scenarios, and then ask us to tell you what you do in that situation. So bearing in mind the competencies we're looking for: problem solving, communication, thinking outside the box, honesty. We want you to be able to answer those questions in the way that you think's right for you. We then have 2 interviews with a clinician, a layperson, and a second interview with an academic and a medical student.
The interviews test different competencies. With the clinician and layperson, it tests more about ethics and how you act in a particular clinical situation, which is quite important. And that brings us back to what Swansea is actually looking for, which is communication skills, honesty, probity, integrity, which you finally see when you get into medical school and go out into the community, go out into hospitals and start taking histories from patients. You don't want to be the doctor that lies in the history. If you haven't asked a particular question which could be pertinent to the patient's pathology, it's important that you actually tell the clinician that, oh, you haven't asked this question, rather than saying the patient doesn't have it, which Swansea has highlighted in the selection criteria. And the academic and medical student talks more about your personal statement and how you've progressed from being from secondary school, depending on what you want to talk about, all the way to what you've been working as, or your previous degree, and even how many times you've been rejected from medical school and what you've done to change it, how you've ensured that you've added different things to your CV, you've experienced different aspects of medicine and how you've learned from that, because it's important that we reflect every time in medicine, see what you've done wrong and see what you've got right, so that you can always improve on that.
Yeah, absolutely. So a typical selection day would be that you'd come to Morriston Hospital, which is on a separate site but very close to Singleton. It has our education centre, which is brand new and purpose-built, and it's right on the hospital site. Sort of the hospital is part of the education centre is part of the hospital. So you'll meet us up there, and you'll meet my fellow admissions director and me, and we'll basically give you what we call a warm-up, which is to try and put you at your ease. Because one of the things about Swansea, we don't want you turning up 15 minutes before your interview and frantically rushing through a multiple mini interview where you're stressed and distressed. We want you to come in, chill, settle down, get to know us, and get so that when you come to your interviews, you give the really best of yourselves.
Yeah, definitely. I would say it definitely put me at ease, because when I first got into the education center at Morriston Hospital, where the interview takes place, I was really nervous, and we all went into this room, and Heidi and John, the 2 admission tutors, they asked us what our name was, where we're from, and something you wanted to say about you. And I remember saying I was a 100-meter sprinter, and other people said different things, and you just laugh and put yourself at ease. There was someone that came up to the stage and did a yoga move, and I was quite surprised, how, because you expect people to be nervous, but everyone calms down after that, and you have a really good interview experience, which is what you want. You want the best interview experience you can ever have, so that it's not because of what you don't have, what you have that you didn't present, that you weren't accepted.
So after the written exercise, we have student ambassadors who are actually queuing up. We've got a waiting list of current medical students who want to be part of this process. They remember the selection day fondly, and they want to be part of it. And basically, meet you, show you around the hospital, show you around where everything is, and be there to answer your questions and keep you kind of chilled and motivated at the same time, which is quite a skill.
Yeah, during the tour, you get to see Morrison Hospital, which is one of the biggest hospitals in Wales, quite a modern hospital as well. We take you around where the wards are, obviously without seeing the patients. We take you through the education center and all our clinical skills, where the dummies we have, how we use them, which is great because we've got a lot of technological advanced dummies here that can show you different heart murmurs, and it could also show you respiratory rates, measuring different skills, which is great. So you get to see Swansea firsthand.
So just to reiterate what we're looking for in the written and in the interviews, we're looking for those 5 areas: communication skills, passion, problem solving, coping with pressure, and integrity and insight. That's your honesty and your reflection. We've talked about the format of the afternoon. To add to that is that your written exercise is marked by 2 independent markers who aren't going to be interviewing you, and then each of your interviews has 2 independent scorers within that interview. So basically there are 6 independent pairs of eyes looking at you and evaluating. So we haven't gone down the pathway of multiple mini interviews because we feel passionately at Swansea that the doctor-patient relationship is about a 2-way communication. It's about understanding each other. And we don't think you can mirror that in a multiple mini interview setting. So we have a dialogue, we have a communication. Each interview is 20 minutes, and that allows real time to have a proper conversation. And almost without exception, our students come out of their interview saying, yeah, that's the best it could have gone. I couldn't have done better. And that's what we want. We want you to feel it went well. So we get as close as we can to an MMI with 6 separate scores per applicant without actually going down the MMI route. And I think it's probably fair and transparent.
Yeah, and I think that's the best way as well, because each 6 independent marker is equal. So everyone has an equal say in whether an applicant should get in or not, which I think fosters your thinking on everyone is equal, even in the clinical setting. Doctors, cleaners, patients, medical students, no matter where you are, we're all equal.
Absolutely. So equal say in the interview process as well. So the timelines, your interviews will take place in Swansea on the 6th or 7th of July, and the plan is that we'll be able to inform you either, if not the same day, then at least the same week as to whether or not you've been successful. And hopefully we'll be able to let you know by phone or by email, but we will formally follow up that phone call with a formal offer through UCAS. The offer is going to be based primarily on how you've done at the selection centre, and it will be a conditional offer on the understanding that you are successful in your occupational health assessment and in your DBS assessment, so that you don't have any criminal records or any reason why you can't practice medicine. It's important to note that your occupational health records are not shared with the admissions team, but if there is anything on your health record that you need to discuss with a doctor, it is important that you let occupational health know. It is not because we are trying to keep you out, it is trying to make sure we give you all the support that you need whilst you're with us. So they are not, one does not affect the other. And one of the important things basically to reiterate, if we haven't kind of made it clear already, although you are obviously really wanting to impress us and you come to that interview wanting to make a good impression, what we want you to realise is that For Swansea, we're doing the same thing. We want to make a good impression to you. We want you to see us and say, that's the best place where I want to be, because I can't imagine being anywhere else, and that's how we want all our students to think.
Neither can I. Even I haven't lived in Canterbury, Coventry, Leamington Spa, London, all in the UK as well. As an international student, Swansea has been the best. The friendly society, the ethos of Swansea has been great. Yeah.
Good.
From a student's perspective, Swansea has been a great place to be. The academics are very friendly and are always open to questions. We have great pastoral care as well, and you've got a personal tutor that looks after you and looks over your academic and both your pastoral needs. For example, if you're not finding integrating into the university life very well as an international student, especially which can occur, you go to your personal tutors and they can find ways of helping you out with it. Even if you have monetary problems, there's always someone to speak to. And the medical school itself has a very great cohort of students. That's probably because of the interview process, because they select the best and the non-academic criteria that they do, because we all foster, we all help each other out. We're a close knit of people. A small medical school, so that means everyone knows everyone, and we help each other out. Second years help out in organizing seminars that in topics that were not taught previously by our clinicians. For example, as we said, it's a self-directed learning course. So second years can teach you and explain the things that are necessary to know. For example, before we went on placement, we were taught by second year on murmurs, and we were also taught on electrolytes and urea. So it's quite important that everyone has this close community feel, and Swansea definitely has that. A week in the life of a medical student in first year, on a Monday, we've got the case presentation. For example, the patient presented with diarrhea and the symptoms they present with. So you can associate those symptoms and those signs to a patient presenting with diarrhea. For example, there could be things like dehydration that are there. And you've also got anatomy on that Monday session. Then that's it for Monday. And the self-directed learning comes into it by you going back to study what you actually need to learn that is written on it. On a Tuesday, we have either our case-based learning, which we definitely have spoken a lot about, going to the GP and learning from the community, or you have LOCKS, which is learning opportunities in a clinical setting, and you go to hospitals, you go to whichever one you want, paramedic LOCKS, you can go to a prison, psychiatry LOCKS, medicine and surgery LOCKS, and you get to experience that on a Tuesday and also revise as well. And on Wednesdays, we start learning the physiology, we start learning the pathologies that are associated with that disease or with the case. And we also learn about the ethics on Fridays, and we learn about how to integrate what we've learned into the wider community as well. And all this happens during the course of the week. And so as you can see, it's a very intense course. So it's really important that Swansea students help each other out, and we have a great Facebook group together where you can ask for things, and people are always respectful and respond to your Facebook messages, which for me says it all about Swansea.
Yeah.
The environment as well is really good. We've got a beach right next to us. It was sunny the last 2 days.
It's been beautiful this spring.
Yeah, it has actually. So you just go there and you relax, which I think is really important for getting your head back in the game as a graduate entry medical student.
And Swansea is situated on the gateway to Gower. Gower is an area of outstanding natural beauty, and we have some of the best beaches in the world. We actually have one of the best surfing beaches in the world. So you can't get to Swansea and not spend some time on the beach. That's the plan.
Yeah. And coming back to the course, we as a student, we can be very lazy, I must say. Sometimes we're very complacent and don't want to learn. But I can assure you, saying this as a student, that if you're at Swansea and you come to lectures day in, day out, you will definitely learn and pass the exams.
That's it. So if you have any questions, by all means type them in and we will answer them as best as we can.
Great. Thank you very much, Heidi and Daniel. Now, I'm just going to go through a few more bits of information for you. And we're just swapping the screens over now. Okay, so after all the information that we've had on the course now, I'm just going to go through the international tuition fees, scholarships, and how to apply. So the tuition fees for the September 18-19 intake for graduate entry medicine programme is at £35,700. You'll have the opportunity to apply for the international scholarship, and you'll make an application to the International Development Office by the 31st of July. And the scholarship, you will receive up to £4,000 off your tuition fees. We've mentioned that the decision will be notified to you via UCAS, so you will also need to apply via UCAS. The application deadline will be the 25th of May 2018, and please make sure that you have already taken your GAMSA exam before you apply, and there's a link there for you to follow then if you want to apply directly on the website. And that's it from me. So my contact details is at the bottom here. So if you've got any questions after today, if you wanted to drop me an email, I will be able to then either answer your queries or put you in touch with either Heidi or Daniel, and then we will be able to discuss with you further. In the meantime, we have received a few questions, so just bear with me. So one of the questions that we've had then to Heidi and Daniel, is it feasible for medical students to have a part-time job to earn some living during their studies?
Well, I can tell you the formal lines of the medical school, which is it is an extremely difficult course and it's very intense. And so it is not recommended that you have a part-time job. But over to Daniel, and I'll cover my ears.
Well, Heidi, you better cover your ears now. Yeah, I know a lot of friends that have part-time jobs. I think it's all about prioritizing, as you would do as a doctor. So you know, during the day you have you make a schedule for yourself during the day, and at night you could have a part-time job that runs in the night. However, you also need good sleep, so you have to make sure that everything is done in moderation, rather than having a part-time job that runs from 5 till 5 the next morning, or however long it is. It needs to be done in moderation, and good sleep is necessary. You also need to study as hard in order to progress on this course. So, but it is possible to have a part-time job and earn some money.
And then the second question we have is for international students, besides a scholarship, is there any loans or grants to cover the tuition fees for international students? With this particular one, I would advise that you go and actually speak to your local the authority in your home country, or even a private loan, because at the moment there isn't anything available that is offered to international students from within the UK. We've got one final question, and is, do I need to have a science degree to apply for the postgraduate medicine at Swansea?
Well, hopefully we covered that. You absolutely don't need a science degree. We welcome students from all academic disciplines. About 2 years ago, we had 2 applicants who had completed a dance degree. We have had philosophers, sculptors. We believe that people who have an arts background bring a breadth to the course and have unique insights into other aspects of life and patience, and bring so much more experience to the course.
Yeah, even at the moment, we've got, on my year, we have people with politics and philosophy degrees. We've got history, English literature, and they don't seem to lack at all, because the medical school has a way of bringing everyone to the same level, to the same power. We have basic science lectures that the medical school run that aren't compulsory, but obviously, if you're not a science student previously, it would be very good for you to attend these lectures in order to get to the same level as science students, so you can start thinking scientifically. Even though medicine is both an art and a science degree, it's important for you to be able to think scientifically, and Swansea enables you to achieve that.
Absolutely. We really are small and we really are supportive, and we have an excellent success rate. And arts or science or clinical background, it makes no difference. You will come out at the end. If you put in the effort, you will be a doctor in 4 years.
Thank you very much. So we've come to the end of the webinar today. So as I mentioned, then on the screen, you have got my contact email address there. So if you've got any questions or think of anything after today, feel free to drop me an email. And if you would like to have a direct discussion with either Heidi or Daniel, I will be able to put you in touch with them. So we're closing now for today. Thank you very much for joining us.